Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. Ask the Doctor Anything, and I'm Dr. Ellithorpe, who is the founder, and we have our every Tuesday night meeting from 6 to 7 p.m. We take questions that you can type in on our website, tlcdoctors.com. You can get on our newsletter, and then you'll get a link and a reminder for every one of our TLC Ask the Doctor Anything Tuesday night questions. So you can type in a question you have. This link will be on there. So if you type it into the link, that way it'll be sure to get to me. And then they hand these to me right before, so that I don't really have any prep time. I work on Tuesdays. I'm in my workout clothes. I always go and do my weightlifting with my husband afterwards. So tonight is the 27th of August, 2024. And we are also doing a live chat. So if you're on YouTube, and you can type in on YouTube in the chat your questions. Whenever I see a live question, I'll defer to the live for those who are actively watching. If you find this helpful, it is a blessing if you would like and then subscribe. Share this with your family and friends. We do make a transcription of this. So if you go on our website, tlcdoctors.com, you can go to the blog, and you'll see all the transcriptions of the questions and so forth. This is for educational and informational purposes. We're not trying to treat over the YouTube, but you'll get my initial thoughts, like getting into the mind and brain of someone who's a licensed medical physician, trained in family practice and general medicine for 40, 50 years. And then all of us here, we share during our clinical meetings. And then you'll get a feel for how we start to look at things. So I'm not saying I have every answer. As a generalist, I've seen almost everything. So I have some opinions or insights, but not necessarily all the answers. So we'll start with our questions here until I see some live chat. And the first question comes from Maxine. Maxine wrote in email asking the question, my daughter is 33 weeks pregnant. Well, congratulations. Her OB recommends her getting a TDAP vaccine, tetanus, diphtheria, and pertussis vaccine. Your thoughts? Thank you, and God bless. I've been practicing medicine for 43 years, and in those 43 years, I was always taught you do not vaccinate pregnant women, and so I'm going to stay in that zone. I also have done so much studying on this issue. If you read the book Dissolving Illusions by Suzanne Humphries, MD, she wrote a absolute volume of information and reference points going through the entire history and development over the past 200-300 years from several countries on the history of vaccinations and the research and data concerning its impact. And then if you compare it with having peace and prosperity and not warring and opening up trade and getting fruits and ships and vegetables and oranges to the population in the higher latitudes that don't have tropics or fruit, you'll see that as nutrition and peace and sanitation and plumbing and cleanliness developed, these diseases dissolved away on their own without and before. The decline was already there, showing long before the institution of these vaccinations, the cleaning up of the infectious diseases. So the name of the book is Dissolving Illusions. The author is medical doctor Suzanne Humphries. I would get that book. You could go to the internet and put up the statement, something like Dissolving Illusions Graph, GRAPH. So she has the graphs in there going all the way back to the 1850s. and she'll show you country by country and the various smallpox, measles, tuberculosis, diphtheria, pertussis, all these things. And then you'll find the impact that right around, the turn of the century, 1900 to, and then certainly by World War II, there was such a drop off in the 1940s of these diseases, and that's long before these vaccines came in. You'll enjoy looking at dissolving illusions graphs as an internet search, and you'll see that there. I hope that's a blessing to you, but no, I don't give that out to pregnant people. Nick has the question. Hi, doctor. My friend has a persisting sore and dry throat for a few days. It seems to potentially be getting worse. Could vitamin C every half hour help? The answer would be yes, especially if it's anything to do with viral allergies, infectious etiologies. And it certainly wouldn't harm anyone, and it would certainly help him because we are technically a people that is vitamin C deficient as a general rule. So if you can explain to me why my friend who had bronchitis did that and it seemed to help. Thank you and God bless. Well, vitamin C is a powerful antiviral. It has immune enhancing, it works as an antioxidant. And so as your immune system gets a breather or help from having the viruses be suppressed with a peak of this water-soluble vitamin C ascorbic acid, it allows the innate immune system, your T cells, to do their job and to attack if there's any specific entity that's creating an infectious sore throat, be it viral or even bacterial. So vitamin C is very valuable and works as a pro-oxidant, meaning at low levels, it's an antioxidant. At high levels, it's a pro-oxidant and very well able to kill these invading pathogens. So that's basically why. Now, another thing about a persisting sore throat, I don't know the age or the comorbidities, but some people get a sore throat from silent reflux of acid. They're eating too late at night. Eating late at night typically is associated with hurting yourself and depressing your immune system. So I would be very careful about eating late and not laying down after eating. I would avoid a high carb diet because the typical American diet is so full of excess carbs that it suppresses the immune system. So that'd be another thing to look at. The other thing we do is we give phospholipids with SBI Protect. SBI Protect is serum bovine immunoglobulins, and the viral antibacterial immunoglobulin in our saliva is IgA. And this is what's in serum bovine immunoglobulin. So if you take it as a powder and mix it as a drink, maybe mix it with phospholipids that help heal the lining of the gut. The phospholipids, remember, I'm always showing you that these phospholipids here are these double layers of fats. So the upper and the lower levels they look like, these things hanging down. That's what's in your meat, your egg yolks, your chicken with the skin on it, your fish, your pork, your lobster, your sardines, all these things. And this helps to repair wherever there might be a break. Okay. So we mix the phospholipids in with the serum bovine immunoglobulin, and it lines like a soothing area, especially if this is caused by the inflammation damage of silent reflux acid reflux into the upper pharynx area. All righty. But again, they should see their doctor if it's worsening or persistent, or lasting a long time. Lena says, should women over 75 take calcium supplements? What kind and how much, with and without food? Lena, I've never done that. And I'm in my 70s, and I have so many women in their 80s with normal bone densities. So the question is, why aren't you getting it from your food? So calcium is very rich in meat and fish and chicken and pork and sardines and lobster and eggs and the like. So by eating these things, you should be able to get the adequate amount you need. Now, as we age, our digestion diminishes, our ability to chop up the proteins and fats, and so elderly people usually have a lot of dental problems. They don't chew well. Then all they want is sugar, pudding, ice cream, pancakes, tapioca, and this hastens their death because we're not made of sugar. We're made of fat and protein. So I would give digestive enzymes. We take Digestzyme, the digestive enzymes that has betaine hydrochloric acid, as well as digestive enzymes when we eat our food, so that it goes into our stomach. We take the enzymes and it helps chop all this up so that you can extract out the minerals and the phospholipids for repair. Now, the other thing for bone density is you want to exercise. If you don't do, like I'm going to do weightlifting right when this program is over, and I'm going to be pushing some pretty heavy weights for a good while. And that will help, build and put some stress, piezoelectric stimuli to my muscles and the attachment, so that I'm able to tell my bones that I'm alive and they should continue to remodel and to work with it. I'd rather be more concerned about the vitamin D level and your K2 level. So, no, I never supplement with calcium. I do have a TLC multimineral that has a broad spectrum of many albion chelated, amino acid chelated minerals to make sure you're getting in selenium and magnesium and boron and manganese. And there is some calcium in that one product. And then, of course, your multivitamin mineral, TLC Energy Core, Mitocore, these have it in there. But it's not meant to be some supplement. When I gave or started rather practicing medicine back in the late 70s, they were saying then, or in the 80s, give people, 250, 500 milligrams of supplemental calcium because we're having so much bone loss. And then it went from 500 to 1,000. Then it went from 500 or 1,000 to 1,500 milligrams of calcium. So I saw them saying, use more, use more, use more. And the bone densities were going down. And I just didn't play that game. I just said, you get out there, you do some exercise, you do some stomping and some muscle weight resistance work. You take your vitamin D and your vitamin K and get your vitamin D levels measured so you're at least in the 80 range for your vitamin D with K2. So that's how we do it. So no, I never give calcium supplements. Edna says she mailed me a bottle of something here on growth hormone releaser. And she ordered it in May of 22, so it's 2 years old. Do you think this product has any nutritional value for my body left in its capsules? And if these are still useful, do you think growth hormone replacement is good for me, and how is it good for me? I wouldn't use anything over the internet. I don't have that to evaluate. Maybe it'll get here. But in general, growth hormone is stimulated when we don't eat late at night. So the older you get, the earlier you should eat. For instance, aging would be to have someone who would become more like a carnivore, Aging would be someone who does weight training regularly. Aging would be someone who would always eat, let's say, breakfast and lunch and not eat late at night. So don't eat late at night. Eat mostly proteins and do weight training. All these things with intermittent fasting and having an empty stomach when you go to bed helps with your body's circadian rhythm in releasing your own human growth hormone factors. Another thing to do would be get up early in the morning with sunrise, put your feet in the bare, wet grass in the morning with sunrise so that that infrared light will come to you and you'll get the earthing or grounding in the wet grass with your feet. That helps with your envelope of the water surrounding every cell membrane in your body. It'll help with the electric potential over every cell membrane. It helps with your circadian rhythm, which will help you if you don't eat a big amount of food or eat late at night, because if you have a lot of stuff in your stomach, that's going to counteract your brain signals that want to be working on your muscles and bones while you're resting. If you dump a load of food late into your stomach, and I think eating anything past 6 o'clock is late, then your brain is going to see that food and not release growth factors. Also exercise, the weight training, weightlifting, and doing this no less than twice a week for a half an hour. I do it 3 times a week for that. Some aerobic training, staying limber and adequately hydrated. These are the ways I would be concerned about supporting my growth hormone level, as opposed to trying to buy some products. And certainly I can't support things from the internet that I haven't clinically tried, or that the company doesn't have a good science and clinical research referencing on their product. So I wouldn't use it. Karen says, recommendations for restless leg syndrome for a 90-year-old elderly woman. Most 90-year-old elderly women are inactive. And the more inactive you are, the more you're going to have cell membrane breakdown. These injury sites, these injury sites right here. So you're going to have more of that. Young people are like this. So motion during the day, walking, moving, getting them to be standing and then stand up and then sit down and stand up and sit down, as they can tolerate, or helping them to exercise, and not being hydrated. Being dehydrated is to promote cell death and to support hurting your membranes. Trying to help them get richer proteins into their diet so they can repair these little damaged spots. So you want to be repairing these damaged areas in your diet with your meat, fish, egg yolks, stuff like that, and with the digestive enzyme, and then giving them minerals. I was mentioning before the TLC multi-mineral, very often extra magnesium, selenium, manganese, and these types of minerals are depleted because they have so many holes with aging poked into their cell membranes. They're leaking out their minerals and their salts. I would make sure they're getting enough salt. You could get some Celtic salt, Himalayan salt, and put a pinch in their water. I would learn about structured water. I would have them drink structured water. You can go to Dr. Gerald Pollack, Pollack, on YouTube. He's a PhD, and he does a lot of research on muscle contraction. And of course, he'll support the mineral recommendations, but he'll greatly support what is called structured water or exclusion zone water. And that's where I've been showing you over the past month or two about my analemma wand, which is this, it's all full of structured water. And when I put it in my glass like this and I swirl it, the crystal in there teaches the water to become a little bit more viscous, a little more thick. And it will help envelope every cell in my body, the 40 trillion or so cells that we have, which will create a better electrical differentiation over the membrane. You're supposed to have about 90 micromillivolts across your membranes to do their work and give you vitality and energy. And that's why if you go out in the morning, if you can take your 90-year-old elderly woman and have her stand for a minute and a half, or just if she's in a wheelchair, wheel her outside at dawn and take her shoes off and let her feet rest in the grass, the wet grass, for a minute and a half to 3 minutes every morning, and let the long infrared go right through her bone, her skull, her tissues. Take her glasses off so it'll go through her eyes, and let that infrared penetrate her body for a few minutes, and get yourself one of these Analemma, ANALEMMA-water.com wands. It's about $170, and get her to drink that. So hydrating her, giving her the minerals, getting her feet in the wet dew in the morning, and that light, that infrared far red light from the rising sun in the morning is the most concentrated and impactful for just a minute and a half to 3 minutes. And then get her to be eating the repair materials in soft scrambled eggs with some butter, salt and pepper it, a little Celtic salt. That should help her. And at night, once in a while, I get cramps, and then if I start to, I make sure I'm well hydrated, because hydration is very important. And I would use this structured water. Remember, that's Dr. Gerald Pollack, Pollack, on YouTube. The electrical structure of water, Watch that. So hydrate them, give them some minerals, put a pinch of Celtic salt, and get on their soft scrambled eggs, and get those good things in them. And that's what I would recommend. Sherry says, what is your thought on taking activated charcoal for stomach upset and or to control loose bowels? No, I'm not in favor of charcoal for that. Charcoal is really designed to, if you get exposed to a toxin, and it will help you to prevent that from being absorbed. You need to be seeing your doctor or find out whatever is causing your diarrhea, what your blood type is, what good bacteria, pre and probiotics that you're taking, things like that. This is what you need to be focusing on, not some item like charcoal. So you have to look at your diet and make sure. Remember, there's only a single membrane. This is one membrane. Remember, folks, that's the membrane. This area is just the cell membrane, and that's the only division you have from the outside world. So your acid soda pops, your alcohol, your even maybe coffee, if that's hard on you, your spicy foods, you have that one cell membrane separating you in your stomach through your gastrointestinal tube. So no wonder it breaks down, and we get leaky gut, and we get inflammatory bowel disease in so many, many, many issues and diseases. So Christine says, I need a quick and easy protein supplement. Bars and powders for smoothies are my best options. I am sodium restricted due to heart failure, so most bars don't work. Is there a protein powder supplement for those of us who are economically challenged? I don't know of one offhand, but I honestly would buy, 4 pounds of hamburger, and I would put them in little mini balls. Just kind of take the bowl and put some garlic powder, onion powder. You might put in a packet of maybe some chili mix or taco mix, and mush that with an egg or two. Well, if that's 4 pounds, I would use like 3 eggs, and make this meat with the egg and the seasonings, and make tiny little balls and cook them up, fry them up, or just put them on a big tray in your oven, and you get these little bite sizes of protein, and they're pretty tasty, and I like them. So I will do that. I'll buy maybe a bunch of chicken legs or chicken thighs, and I'll sprinkle them with some paprika, onion, garlic powder, salt and pepper, and I might use an egg paste on them, and I'll cook up, 20 of them or 30 of them on a tray. So I'll have a tray of chicken, and then I'll have a tray of my little meatballs, and then very often I'll do pork chops. And what else do I do? There's one other thing. Oh, bacon. I have another tray in which I lay my bacon out like that. So I bring real food. I don't like buying stuff that's processed. So I work very hard, and I take the time twice a month to go out and go to the store. I usually go to Sprouts to get as grass-fed as I can, natural things. I also use Butcher Box, or now I use Merriweather Farms for my meat. And I'll just get a bunch of it, and I'll cook up a lot, and then I get my little Ziploc bags, and I'll put a bunch in my freezer. And so when I come to work in the morning, I grab some chicken, or I'll grab some hamburger little balls, or I'll grab some bacon, or I'll grab some chicken or pork chop pieces. And by the time lunch hour is here, it'll have thawed from being frozen, and I'll just bite on it. I have a little mini refrigerator in here, and I have mayonnaise in there, so that's no carb. And I'll dip it in mayonnaise if I think it's too dry, and then I will, and that's what I eat. I'm not here to entertain myself. I'm here to eat well, and to try and stay well, to help my patients, my family, and serve God. Okay, so I'm sorry I don't recommend these powders. I have some powders here, but again, they're fancy dancy and higher cost, and I never use them. I just don't use them. Sorry. And this way, there are no carbs in them. Let's see, what's the next thing? We have a dry throat, and I need to take a sip and wet my whistle. Ophelia says, what do you recommend for an ear fungus? And she then asks with a question mark, Argentyn silver? Well, yes. And how much? If yes, and what about tea tree oil? Thank you, and God bless you. Now, a ear fungus is a serious thing, and any of these things, if you're not improving with these simple natural suggestions, you need to see your local doctor and have it looked at. This would be something I would want to see, Ophelia, and what's going on in your ear. Yes, in general, Argentyn acts as an antifungal. There's no limit to how much you can put in there. There's ear drops that you can, in a dropper mechanism, you can put drops in your ear, but that has to be watched by a physician and managed. And maybe cultures need to be taken, or maybe you already had that if you know it is a fungus. But really, fungus needs to be dry and with a good air circulation, and it needs to be in a low carb body. And so there's just so many things that I would want to ask and look at. I would want to be seen by a doctor and managed for that. John says, can insulin resistance be determined by looking at insulin level and hemoglobin A1C from a blood draw? It can be inferred. Really, insulin resistance is done by what we call a HOMA, capital IR. And that is a number where you take your fasting blood sugar times your fasting insulin. And in American medicine, you divide that by 405. If you're in European numbers, metrics, you would take your fasting glucose and insulin and divide it by 22.4. But these are then, let's say your fasting blood sugar is 100 and your insulin is 6. Well, then you multiply that, that's 600. If you divide that by 405, it goes in 1.3 or 4 times. Anything above a 1 is insulin resistance. So more important would be fasting blood sugar, fasting insulin divided by 405 in American lab units. And that's what I would say. Now, hemoglobin A1C is a long-term amount of glucose sticking to the protein hemoglobin. Now, sticking to all the other proteins, it's just the hemoglobin is easy to collect in a blood sample and get an assay on it. But if you have 5% of all your hemoglobin stuck with sugar on it, it's going to inhibit the function of that wonderful oxygen-carrying protein. So the higher your percent of hemoglobin A1C is really sticking to everything, and your lens, the beautiful lens in your eye, and it makes those proteins stick, and you get cataracts from that. So yeah, you need to have low carbs, and the formula is fasting insulin times your fasting glucose divided by 405, and that needs to be under 1. And really, the only way you can get that number, I've always been telling my patients, I want your fasting blood sugar to be 85. Many people will remember that about me. And now you realize that if your fasting blood sugar is 100 and your insulin is a 6, and most doctors call that normal, and that total is 600 multiplied together. So you're already onto insulin resistance and disease through your doctor's visits who don't study these things and look into them. That's why I'm always called so hard and severe on my patients and myself, because I demand fasting blood sugars 85 or less and insulin's 4 or less, and some 3 or less. So you'll never be over 1 if you're 85 times 4. It'll never happen. You'll be not insulin resistance, and then divide that by 405. So see, there's a method to my madness. Vivian says, my friend, who is apparently a patient of mine, she states, is scheduled for a biopsy for prostate cancer, even though the specialist doctor said it's unlikely he has cancer from physical exam. And the lab test result of a PSA was 4.1. I think this is unnecessarily risky, because biopsies, I heard, can actually spread cancers that would otherwise be contained as a tumor. Your thoughts? Well, Vivian, I don't know who this is, but a person with a PSA of 4.1 and a normal digital rectal exam in the anus on a man to feel the prostate, I would be, concerned about being overly aggressive. So, if he is my patient, as you said in your question, have him call the office and leave a message with my nurse, Terry, Teri, so that I can pull up his chart and figure out what's going on. Yeah, I don't think we should be doing invasive biopsies unless we have, real concern that there could be other outlying issues. Maybe he felt something, or a big nodule in the prostate. Maybe he had a percent free and total PSA that were concerning. So I'm not saying not to obey and follow through, but if he is my patient, I would like to look into that. So have him call my office here with Terry so I can get his name and look in his chart. Constance, she asks, can Vitalzym be taken at bedtime instead of morning? Yes, absolutely. I do it every night. I understand that you can't eat for an hour before, which includes morning coffee. No, I take my morning coffee and I swallow my Vitalzym down with it. My morning coffee with my Vitalzym. But I am drinking, several glasses of my water. I mean, big glasses. So no, don't get yourself all, tied up in a watt over. The only thing you have to worry about is you take digestive enzymes, Digestzyme. So this would be my digestive enzyme. And you take that after you ate a meal or during the eating of a meal. That's with food. And then the systemic enzymes have to be on an empty stomach. So I take mine first thing in the morning, 5:30, 6 o'clock in the morning. And I usually don't eat until 2 or 3 in the afternoon anyway. So that's a long time of emptiness. And then I'll take it again around 9:30 or 10 as I go to bed. So systemic is empty. Digestive enzymes are with your meal. And yes, you can take it with coffee. Let's see, live questions. I see some. Anita says, Dissolving Illusions by Suzanne Humphries. That's the correct one, Anita, yes. And then she said, that bottle was delivered last Friday. All right, so I'll go look for it, okay, and see, because I just got here today, and I don't have this bottle. I'll look for it. But again, it's 2 years old, so that growth hormone bottle really, I don't know that I would use it after 2 years. All right, Christina in the live chat says, hi, Dr. Rita, my mom is 73, has high blood sugar and cholesterol. She changed her diet about 3 months ago. Her fasting glucose is higher in the morning than the afternoon. Why? Why is that? Well, there's a lot you have to know about your mother than to just say that in particular. Is she on beta blockers? Beta blockers can raise your blood sugar. Does she get outside in the sun? Infrared helps lower blood sugars. If she doesn't get outside very much, that'll be a problem, especially in the morning. Does she drink enough water? Is she doing exercise? What is in her diet? You said she changed her diet, but she might have changed it and gone to more whole foods, but they're richer in carbohydrates. She might be eating more fruits and more vegetables like yams and beets that are very high in sugar, maybe bananas. So look at, it's just too difficult with a number like that and her age to say any one thing. So is she on any steroids? These are various things that need to be evaluated, Christina, and I can't give you any more thoughts that run through my mind. So have her see the doctor and discuss it, and keep a log of her diet and her activities and the time she goes to sleep and the time she gets up, because these stressors, cortisol, stress can raise up the blood sugars, things like that. Anita says, thank you, Dr. Ellithorpe. You have already answered my question regarding this bottle that I mailed to you last 30. Thank you. Okay, very good. All right, so let's go back to these questions. The next one is, I'm curious if chelation challenge, this is an IV, is safe for someone with hip replacement. The answer is yes. I have it scheduled for November and just want to be sure. Thank you. Absolutely. In fact, there are those who would argue that everyone who has surgery should have IV chelation the day before or the day of, because it helps prevent blood clots and other damaging effects. If you watch the YouTube um, TACT Update 2019 with Dr. Lamas, Lamas, TACT, TACT, and that it represents Trial to Assess Chelation Therapy. So the anachronism is TACT Update 2019 with Dr. Lamas. When you pull that up, if you scroll down, you should see right under it a few videos below it. There's one called Chelation Therapy Data Review and Development, an inside look with Dr. Dorothy Merritt, Merrit, MD. That is absolutely knockout wonderful to watch on chelation therapy. And it'll talk to you about how life-saving that is. They did studies on, I think it was rats, and they tied the renal artery and tied it off, shut off the blood flow to the kidney. And then they had another rat group and they gave them chelation therapy. And then they tied off the renal artery. And then they sacrificed them, I guess, a set amount of time later on. And what happened was the ones who didn't get chelation therapy, their kidneys showed the breakdown of the glomeruli and the kidney tissue structure significantly. The ones who got chelation therapy, it was almost impossible to see any damage to the kidney compared to the two groups. So same rats, both had their arteries tied off at the same time. And then after some period of time, I don't remember how long it was, then they sacrificed the rats. The ones who didn't have chelation, their kidneys were all hurt by the lack of blood supply. The ones who got the EDTA chelation almost had no kidney damage. So I have that study in a handout here called, what is the name of my study? It's a summary of the benefits of EDTA chelation therapy. So if you ask the front office for our handout, I have that referenced article in there and you can look it up. All right, the next one is a live question from Mary. She's saying recommendations for labile high blood pressure other than Losartan 25 milligrams. Well, Mary, are you well hydrated? And now that we understand the great importance of the envelope of that exclusion zone water over every cell in your body and how important that electrochemical difference is, hydration with water is critical. But then if you can get this as structured water and do that, that would even be better. Watch the YouTube Dr. Gerald Pollack, Pollack, the electrical structure of water, and it'll blow your mind about blood flow and resistance and lowering your blood pressure. Of course, exercise would be critical, both some resistance and aerobic training at least twice a week for a half an hour, bare minimum. I would do it 3 times. I do it, my weight training 3 times a week, and then my aerobics the other days. A low carb diet, a good night's sleep, and a consideration of magnesium, supplementation. So there are many things. Then chelation therapy would be another thing. These would be recommendations for labile high blood pressure other than Losartan. I would get outside in the morning at sunrise with my bare feet in the grass for 2-3 minutes and just stand there and let the electrons from the earth come into your body, help all the enveloping of your cells and help relax you, and it will set your circadian rhythm. It'll help lower your cortisol. It'll help the depth of your sleep at night. And if you're hydrating enough, it will help you with making structured water in your own body. But you can assist yourself with, like I said, this water wand called the Analemma water wand. Then let's see, the next email I have is Brenda. She asks, leptin, insulin resistance, menopause, 55-year-old, healthy eating, type O blood, menopause, high stress in past, cortisol issues, adrenal, subclinical hypothyroid, suggestions for getting the weight to come off. My problem is not what I eat, but probably that I do not eat enough or didn't for years. Tried carnivore and it didn't lose a pound. Brenda, yeah, there is a situation, it does sound like, and I've seen even very obese people, they eat very little. If they do the calorie counting, they'll be 750, 800 calories, and they still don't lose weight. And one of the things is high cortisol chronic stress is going to just prevent that leptin, adiponectin, glucagon, feedback cycle, satiation and eating. And then you lower the amount of calories you eat, trying to lose, you might even exercise some, and that just adds stress. This is turned into too much of a stress feedback in your body, and you wind up retaining the weight just from all the stress of your life. So it could be, in order to lose weight, you need to eat more food. Now, you can't be overly liberal with this, but you need to maybe have some carbohydrates. So some people who go pure carnivore, they lose some weight, then they hit a plateau. And I don't tell them not to eat some carbohydrates, maybe some raspberries, maybe some squash, some cooked vegetables, asparagus, green beans, broccoli, buttered up, salted and peppered. And then they start to have another breakthrough. So the body with low carb might flip that into an excess stress response, and then you can't lose weight because of the cortisol blocking. So I would try eating a cautious amount of healthy, real food, complex carbohydrates, and that with a generous portion of your healthy fat and protein. And I would shift to eating breakfast and lunch as opposed to dinner, and add in your exercise, and then see if that will help you, Brenda. Leah says, hi, is Vascuzyme considered an SPM? I don't know what SPM stands for. Vascuzyme is a systemic enzyme. I'm guessing it is by the article I was reading. Wouldn't it be good for high blood pressure? And what supplement do you recommend for occasional high blood pressure? Not super high, thanks. Well, I don't know what SPM, that anachronism, stands for, Leah, so you're going to have to type it in, or if you're live, and let me know, because I don't know what it stands for. Yes, Vascuzyme is a systemic enzyme, and it improves microcirculation, which will enhance blood flow. But now we're learning about infrared light, the circadian rhythm, and the structured water enveloping every cell membrane in your body, and the critical need for hydration. So I'm going to say that with the exercise and the multi-mineral, TLC multi-mineral, to get some albion magnesium in you, that would be the direction I would go. Rhonda says, I'm 59, in good health, exercise, on hormone replacement, organic diet, no alcohol or drugs, drink lots of water, but I'm getting lots of spider veins on ankles, smaller varicose veins on the calves, and now a vein in my thigh is hurting but not visible. My heels are getting dry and cracked also. Could it be a liver issue or bad valves? Appreciate your guidance. I'm going to tell you the most common thing, and that is just age. As we age, the thickness of our skin gets thinner. And with that thinner skin, the little venules and blood vessels that were always there but had a higher cushion of robust elastin, collagen, and fibrin and tissue is now thinned out. And so then you can start to see these spider veins show up. Also, this is very often maybe some expression of a vitamin C deficiency or borderline deficiency, which leads to the elastin collagen breaking apart. Vitamin C with hyaluronic and enzymatic action makes strong elastin collagen tissues so that you don't get aneurysms blown out or diverticula or varicose veins. So those are some of the thoughts I would share with you. Let's see, Rhonda, about your tissue and things like that. Grounding, earthing is another thing that helps blood vasculature and adequate hydration. So that's the direction I would go in, and I would get my hormone levels measured. You might be on hormone replacement therapy, but it's too little or chronically still low. So look at those things. Asia says, hello, Dr. Ellithorpe. My father is experiencing hearing loss. He also has tinnitus, ringing in the ears. He took a hearing test and it was below normal levels. He is going to look into getting a hearing aid, but I'm curious if you have any advice or recommendations on hearing aids or other methods that could help him. Thank you. Other than the healthy lifestyle things, Asia, that we talk about, and I think I know who you are, Asia, because it's a unique name. And I would look toward having your dad get to a functional integrative doctor. Chelation therapy will help the microcirculation into the hearing apparatus all throughout the body, but in this case, also it'll reduce heavy metal toxic levels in your body and the burden. Adequate hydration. Those are the directions that I would go in, and not clogging it up with a high carb diet. And that's the direction I would go. Get some chelation. Marilyn says, I was a longtime patient of yours before moving out of state. I used to get calcium disodium EDTA 1,500 milligram suppositories from your health store. And before that, a compounding pharmacy. I haven't found any here. There are several on the internet, and she lists detoxamine, Kelatox, Kelatox, and Kelamin, Kelamin. Do you know about these? Any suggestions? No ACAM doctor within 3 hours. Well, Marilyn, EDTA chelation is a prescription medicine, and it's illegal to make this available on the internet because it's a prescription medicine. So I am very dubious about these resources. The old brand name that I used to work with was Detoxamine for calcium disodium EDTA. But in America, you cannot sell this. So if there's some internet, a foreign source you're getting it from, I can't verify it's a good product or anything. So I'm cautious. If you can make it out here and reinactivate your chart or see one of our doctors here, we could probably order it and have it made for you. by a compounding pharmacist, but that's the best thing I can suggest, Marilyn. Alice says, my husband, Jerry, is healthy, 54-year-old man who has developed shingles a week ago on the left arm and shoulder only. Although they have scabbed over, there is still some pain and discomfort. His primary doctor treated him with gabapentin and valcyclovir, also suggested Advil. My question is, what would your method of treatment have been? I would have put him on high-dose vitamin C IVs, and I would have done a series of 3 that very first week. And then I would have had him, really probably fast the first 24 to 48 hours so that his whole immune system could work on that viral outbreak along that one nerve line. I would have him on the Vitalzym to disinflame it and help clean up the debris and inflammation. Fasting the 2 days, things like chicken broth, beef broth, just clear liquid, see-through chicken and beef broth, nice warmed up and sipping on and relaxing with it and taking some enzymes, anti-inflammatory. I would have given him high-dose vitamin D, probably 50,000 international units, 1 a day for 5 days. And then, if he wasn't better within 2 days, I would probably give a prescription of the valcyclovir, which is a prescription drug antiviral agent. Quercetin is another natural antihistamine capsule that works as an antiviral also, and the multimineral with zinc in it also helps. So that's the direction I would have gone. Denise says, can you touch on pre, pro, and postbiotics and how to get all of them in your diet? Postbiotics is new to my ears. What is their benefit to the digestive tract? Thank you for taking valuable time to help us all. Denise, prebiotics would be taking the food that feeds good bacteria. So if you have onions, avocado, what else? These are vegetable pasty items. So I guess I would have to go on. I eat lots of onions if I'm going to eat anything that's a vegetable and go off my carnivore diet. But it is the food for which good bacteria eat. So onions, garlic, avocado, these kind of inulin, this kind of stuff helps feed the bacteria, this organic material. Then the probiotics are the good living bacteria. And the postbiotics is stuff like when all this digestion is done, there's short chain fatty acids. There's the vitamin K2 is made from this digestive process. There's B vitamins made. There's various chemical byproducts that help suppress bacterial endotoxins, toxic stuff that some of the bad bacteria makes. So there's an entire ecosystem living in your gut. So eating a low-carb diet, getting in certain prebiotic organic materials from eating the avocado or the onion or the leeks or the garlic, taking in probiotics in yogurts, taking in fermented foods that are rich in probiotics. And then in the digestive process with digestive enzymes, especially as you get older, it helps you chop them up so you make the postbiotics, which is the short chain fatty acids and other biochemical products that help fight off endotoxins and other materials. That's what it is. And then we'll have to end here, I guess, because that's all I got to. And it's 7 o'clock. So we had quite a few questions. If this is of value, please like and subscribe. Please share this with your friends and family, and tlcdoctors.com. And then this last page we'll get to next Tuesday at 6 o'clock, and we'll go from there. And in the meantime, love, the greatest thing we can do is try and love one another and be patient with each other and always help our brothers and our sisters. And that's everyone. Our neighbor is everyone. All right. So God bless everyone. Take care.